What we are doing is not specifically putting a lot of money into it, but we put a lot of expertise into initiatives where people are trying to create what we say a sustainable insurance system. Interesting, one remark on the discussion we had before is we are talking about the important role of governments and actually the volatility of governments and the impact of that on creating a sustainable system. But we are talking also about insurance. So get back to the basics of insurance. You need mass enrollment, not only burning houses who insure themselves. You need distribution, telephone providers who can play a role. You need to have premium collection. Actually, people are wanting to communicate, want to eat and want to stay healthy. So in that triangle, maybe things can be organized, but there is some premium collection for the cell phone, so it must be able to collect premium for insurance. You need to organize claims handling and there need to be healthcare provided. So if I look at it from an insurance perspective, and you want, in the end, to have a sustainable system, you have to have that all in place. It's more than just politics. You need to create an awareness within a society, and it helps to start small if the government is not supporting. But you need to have a society where people are willing to trust each other, where investors are willing to come in to put their money there and know that there will be some returns. And as long governments are not supporting that or are too volatile, you need to have it on a private basis. I don't see another solution. If you look at our perspective, again, coming back to your question, I would say we are not into this because we think we will establish, let's say, a relevant insurance portfolio within a few years in these kind of difficult markets. But at the other end, somewhere in the back of my mind, I'm thinking, when we are there, and it fits in our strategy, it's part of our the group's identity, and we can allocate part of our profit to these kind of initiatives, but add on that expertise which we can provide. I think we can support small steps, and I believe many small steps can also create something. So that's where I come from. But in the end, bear in mind, insurance has also some technical laws which always stay applicable: mass enrollment, adequate premium calculation, and be able to provide what people are buying. So if they pay premium for health care, if there is an occasion, you need to provide health. So that's how I look at it.
Yeah, so large numbers, small margins, if you're on the sustainable side, because you can't be making a loss if you're trying to run a sustainable thing, so there has to be a small margin. And then what you're really emphasizing the capacity side, the technical infrastructure that's needed to make this thing work. And that may actually be where some of the international stuff may have its real value added, is bringing some of this technology to the table. Anyone else that wants to jump in on this question of what could the donors do better? Yes.
I'm working with Wemos, Dutch NGO. When you raise the issue of what the donor community can do, there's one thing that I am missing a little bit in this debate, and it is the international perspective of inclusive finance. As you put it yourself, 97% of health insurance is political. So I think what we can do in terms of technical assistance, it's useful, but it will always be limited. So we have to ask ourselves also, what is our role in increasing tax resources in resource-poor settings? And I think there's an issue where the Netherlands can play a role because it's hitting the news more often lately as one of the tax havens. And I think it's also our responsibility to see what we can do in terms of addressing issues such as tax avoidance and tax evasion. So I would like to see if we can get a reflection on that from the speakers. Thank you.
Thank you very much. David, you had another comment on the donors?
Yes, I think the donors should be doing what others are not and where they can get the best return on their money. And that means insurance education is an absolute must. We've discussed that before. But nobody wants to pay it, and you can't add it onto the premium. This is where the donors should be focusing. The second thing is, with all due respect, I do not think that the private sector is very successful or very committed to delivering either front-end or back-office services at the base of the pyramid very successfully. They do it where there is an obligation, but otherwise very little is done. On the other hand, reinsurance is a must in the industry. If we don't have reinsurance for the small schemes, there will be no sustainable insurance. So the donors can do reinsurance, and you and I have published about that a decade ago. I don't need to elaborate more. The third issue is this. There are very many, both institutions and individuals, who want to help this development happen. But today, they cannot reduce such investments from their tax liability. I call this insurance education and the other support to the infrastructure intangibles, embedded intangibles. If the embedded intangibles could be charged on balance sheets and therefore taken into consideration for tax in the rich countries where tax happens, including from corporates, it would no longer be CSR, it would be a reasonable investment that goes into the usual consideration that I either capture tax benefits where I pay taxes or I invest against return. As here, investment against return is a non-starter. Do it with a lot of rich companies in rich countries through embedded intangibles. And if you do these three things, you will have a turnaround.
Well, thank you, David. So I think we'll now just go back to the panel again for a last round of just remarks. But if we could keep the reflection on looking forward, you know, what concretely could we do to help these schemes become more sustainable, but also the sunset issue and the issue of sustainability. Christoph.
Yeah, let me kick this off. I think, and I worked for the Commission on Macroeconomics and Health. 10 years ago, we came up with the estimate of $35 per capita. It's required to finance a package that will allow us to achieve the MDGs. There has been a paradigm shift in the sense that we believed at that time it would be a global responsibility to finance this. But what happened actually in reality is that most of the countries significantly increased their spending on health, including in Africa. So it's not actually the donor money that matters so much. It's really what countries have been putting into financing this package. With this, I totally agree with the colleague. What you said is it's a broader question about how do you finance government expenditures through taxes, build tax systems that are broad-based with low contributions that are progressive. That is the challenge we finance that we face to set this on the right footing. I think where the donors still have to come in is in bad times, in crisis times. We did this as the bank during the crisis where we simply started to finance premiums, health insurance premiums in countries to stabilize the financing and the coverage during the crisis. I think that is vital. And then the obligation, and there's still a lot of work to be done, is we have to build the knowledge to make these systems work and as efficiently as possible. And this is always a problem where the focus on investment financing. This has to be really a major investment into the knowledge to make them work.
Thank you, Christoph. And Fola, if you could have 3 wishes from the donors that we're not already doing, what would they be?
I think the real role of development money, to be honest, especially in something as nascent as health insurance, you know, in our context, has to be to help to reduce what I'll call the hurdle rate of other funding. and particularly the hurdle rate of what we'll call investment funding. Because we know that there is a, yes, we want to see an investment rate of return, but we also want to see this development impact happen. But in the early times, until we can build that scale, until we can build the mass volume, the mass pool that is required for the risks to be taken care of, it's, you need that gap to be filled, somehow. Gap to be filled certainly for the more technical expertise that's required, in terms of really being able to fund the sort of the early days of a distribution network, of a claims administration system and so on. But certainly it's not out of place at all to sort of see what the health insurance fund is doing be brought up to bigger scale, where you also help to de-risk the demand, the demand revenues to really build this critical mass, this pool. Because without it, it's tough. Because one of the things that I hope that also, is how do we make sure that donors and development partners work much more closely and much smarter with local institutions. Because very often, a lot of the work that the donors and development partners do not end up really, lasting in terms of really creating the kind of skill set or capacity on the ground. So there's an intervention, it happens for a few years with government support and so on. But then the local institutions who really could take this, have learned from it, improved from it, and keep going with it, are still left as fragile as they were in the beginning. So I hope that that's something of a gap.
Yes, thank you. And William, you want just a thought more?
Yeah, one additional comment. As a relatively newcomer in this kind of debate, I see that there's a lot of fragmentation. Not only all kind of aid organizations who are very conscious but beautifully working next to each other. I think there is something to win if they start to work together more closely. But looking at ourselves and at myself, I sometimes imagine what will happen if all the donors, which I know from the insurance industry, as a member of the International Federation of Health Plans, let's say the World Organization of Health Insurance Companies, and listening to beautiful stories and initiatives they have done and made possible in various situations. Sometimes I question myself, what will happen if all these forces are joined together to take out overlap and to create, let's say, to combine this power and see what happens then. So I will certainly table that at the board of this federation, but it's a big question mark for myself. So maybe beautiful things can happen in the future.
I think it's a very good suggestion putting that on the table, particularly because I think the insurance companies internationally are getting back into the development. They had really exited for about 20 years, but in the last 3-4 years, when it's increasingly beginning to see large insurance companies coming back in again. Kama, you got the first word and you get the last one.
Thank you very much, Alex. I'll talk specifically about Africa. The African head of states have already declared this decade as a decade of health insurance. And every country is supposed to show annually what steps they've made moving forward. And working across the continent with the different ministries of health and ministries of finance, the biggest disappointment that I have is the confusion that donors bring on the table. You come with some money, yes, but you also come with a lot of confusing advice. DFID will come and recommend something that is akin to the British health insurance system. The Germans will come and give something that looks German. The Dutch will come with something that looks Dutch. The French will come with something. The Greek, I don't know what they'll come up with. And yet, you are talking to the same ministers of finance and health who want to find a solution for their own people. This, to me, is a failure. And if we don't do it right, we are going to be in this kind of meeting for the next 2 decades and not gone anywhere. We are wasting time. We are giving bad advice. We ought to get our act together. Second is that let us not lie to our countries that any of the donors can fund a sustainable health insurance, a social health insurance in a country. No. That has to be the country's responsibility.
I'm sure you'll join me in thanking the panelists for their very valuable contribution and also from those in the audience.